All right. Hey, what's up, guys? This is Dillon from Vape, and today I'm really with a really special guest today, and his name is Mr. Moon. Sorry, Dr. Moon. Dr. Moon, do you want to introduce yourself?
Yeah, hi. I'm Dr. Edward Moon. I'm a general and gastrointestinal surgeon by training. So I've been in practice for about 22 years.
Mhm. All right. So let's just get right into the questions. So, Dr. Moon, have there been any vape-related cases in your hospital? If not, have there been any general drug overdose cases?
The drug overdose cases are there all the time.
Hmm.
So there are many different types of drugs, and we see them almost every day in the emergency room.
Oh, wow, every day. Wow.
Yeah, you always see some type of overdose every day.
Uh-huh.
Uh, Vaping injuries were a problem
Hmm.
last year. I can't remember exactly the time, but sometime in mid 2019, across the US, there are quite a few patients that are coming to the hospital. They were sick enough that they had to be hospitalized.
Hmm.
But I do not know because I'm a general surgeon and I don't take care of these patients firsthand.
Right.
Whether my particular hospital had a patient admitted for the vaping injuries, but that was a problem. California was one of the kind of a big state where we had a lot of cases, so that I remember. Um, I don't know if there's ongoing problems. The way I understood, there was some increase, and there were a lot of patients sick. Some patients died, uh, but I think the numbers have come down since then. Uh, I'm not sure about any recent admissions or patient being taken care for it at this time. But at least about a year ago or so, we had a sort of a big outbreak of these problems at the time.
I see. So, considering that vaping causes inflammation in the arteries, what are the implications of clots forming in the arteries? And in other words, how is this dangerous to a patient?
The so the vaping, as I understand it, is kind of devised as an alternative or a less harmful way of uh, getting nicotine instead of actually smoking a cigarette.
Right.
Okay, because the cigarette has it's obviously made out of that cigarette plant. The leaves that they dry up and they smoke it. So what's in there? It turns out that it's not just the pure nicotine, but it's got a lot of harmful chemicals. Many of them are carcinogens, so they do cause a cancer, right?
Right.
So the inhaling the smoke into your airspace, so you have to breathe in these things, and through the upper airway, we call the trachea and the bronchi, and then into the airspace, all these lining cells of our pulmonary system, they get injured by the smoke. So vaping, you have a nicotine that's immersed in a preparation, typical oil-based substance. So they think it's actually vaporizing it. It's actually not a water vapor type of thing. It's actually, you turn it into fine particles, chemical particles. So you
Mm-hmm.
breathe in these things. So when you purify nicotine and do that, so can you just deliver nicotine without all these other harmful chemicals? So theoretically, they felt that this is probably safer this way. So if you're addicted to cigarette smoking, can you do vaping? So you will have a less harm to your body.
Right.
So, but what we have learned over the last many years, I think, this is probably going on for at least 5 years, I believe, this vaping issue, is that it's actually, we wouldn't say it's more harmful than the smoking tobacco itself,
Hmm.
but it's not a safe alternative. That's what we know.
Right.
So there are other chemicals still in the vaping things. Nicotine itself is a very addictive substance, so people get addicted to it.
Hmm.
This kind of chemical addiction is no good, particularly young brains. If teenagers smoke, get a lot of nicotine into their system, uh,
Right.
there are many studies showing that it does affect their brain, right?
Hmm.
So addiction is obviously coming from the brain as well. So certain centers of the brain you're constantly stimulating, and you have to have this kind of repeated gratification.
I
But
see.
not just that, but the global brain function is affected by getting nicotine. So nicotine itself is no good, but it turns out that there are other things in the vaping itself that actually harms both your airways, lungs, as well as other systems, like you said, particularly heart and blood vessels. Yes,
Right.
can you have a blood clot? Of course, yes. But can you affect the heart? Yes. And by doing constant vaping over time, do your lungs get damaged? So you wouldn't be able to use your lungs very well at later years of your life. So these are all concerns.
Mm-hmm. Definitely. I see. So what are some of the indications in an X-ray that someone is prone to a heart attack or stroke, which are common symptoms of overdosing on vape chemicals?
So let me try to understand that question better. So if someone's doing a lot of, say, vaping,
Right.
and what are the signs when we see them, say, and then investigate them with, say, X-rays and other things? What kind of things can we pick up
Right. Yeah.
on the study?
Mm-hmm.
So if the vaping results in, say, lung injury, right? So the kind of big epidemic that we had last year with a lot of patients dying, their lungs look like someone with the ARDS. So it's called the adult respiratory distress syndrome. So their lungs get, you know how our lung works, because we breathe in air, which contains about 20% of oxygen. And then there's a very thin membrane, it's called the alveolar sac. Okay. When it comes down to the very inside of the lungs, it's a very, very thin bubble. And this bubble is aligned by our lung cells. So these cells have to be constantly in contact with the blood and stay moist. And then when the air comes in, tiny capillary passes through, so it will pick up the oxygen, which is higher in the regular air than the spent blood that has, we used up oxygen in our blood. So by the time it comes back to the lungs, the amount of oxygen in the blood is very low. So the difference, right? The oxygen wants the higher concentrations to lower concentrations. So we have to be able to maintain our microscopic architecture of our lungs. But if this process is damaged, when you look at it, a big picture like an X-ray, the lungs don't look as, we call it lucent, because there's a lot of air in these alveolar sacs. So X-ray penetrates much better, so it looks darker, so it looks like a lung. But if you have a problem with this, you get damaged, and there's a lot of water and leaky blood vessels, so leaking fluid and stuff. So the whole lung looks more like a ground glass. So the trained eyes by radiologists, or even any other physicians, when we look at it, their lungs look horrible. So many people died of this. So they went on the ventilator. So when this happens with right now with a COVID-19 infection as well in severe case. So many things can cause this kind of condition. But that the lung injury caused by vaping, if it's very severe, you can easily pick up. But these patients, by the time you reach that kind of thing on the X-ray, these patients not do the proper oxygen pickup from the air. So they're gasping for air. So they're very, very short of breath. They're very labeled breathing. So as if you're drowning, right, in your own water. So they'll have a lot of symptoms by the time you have a severe lung injury like that.
I see. And let's see. Have you received any patient that was an adult who had a history of vaping or using any other narcotics? And how did their drug-related history affect their health and diagnosis?
So we, keep the electronic medical record, so which makes it very easy for us to look at a patient with all different histories. There, say, previous surgery history, social history, all these things are in the chart. And of course, anyone who had a addiction history will be able to see it in their history as well. So particularly smoking is a big issue. So we always see if someone is an active smoker or has a history of smoking, maybe not a smoker anymore,
Right.
and how much of a smoking, we call it pack years. So like if you smoke 1 pack a day and you smoke it for 1 year, we call that 1 pack year. So there are patients with 80 pack year smoking history.
80?
So obviously the more exposure. So if you smoke 2 packs a day for 40 years, you will have an 80 pack year smoking history.
Wow.
So that's a lot of smoke going into your lungs. So if you look at epidemiologically, you will see that there's a good correlation between, say, lung cancer, or even without producing cancer, let's say something like emphysema, or there are many other what we call COPD, chronic obstructive pulmonary disease. These numbers correlate with your pack years. So the more you're exposed, the more likely you'll develop these things at later years.
I see. Yeah.
So we see this, and then we see patients with the overdose issues. The narcotic overdose is the #1 problem right now. So there are people do other street drugs, or maybe cocaine or some other things. But the big problem by number is the typical narcotic medications like morphine or heroin. There are so many variety of these medications are produced in terms of pills or liquids or all these things. We use them in the hospital. Patients who have a surgery in pain, they need to be treated for pain, right? So give them all these narcotic medications. The last about 20 years or so, the doctors were very generous in terms of giving narcotic medication to the patients, because leaving somebody in pain was considered unethical. So we're very liberal about writing these things. But the consequence of all these opioid epidemic that we see right now is the result of a very liberal policy of giving pain medications without really checking on that.
Yeah, that's true.
There are many addiction issues. So we have a lot of opioid addiction patients. And then you will see other patients, say street drugs like heroin or cocaine, methamphetamine. These are quite common problems, I have to say. And every night the ER has to deal with someone who's overdosed, on methamphetamine or something like that. This is just a constant problem.
Right. I see. Yeah. And it's actually really sad because once, like, if a patient is in pain, doctors may reflect like that they don't want to see them in pain, so they give them, like you said, painkillers liberally. But that patient may be hooked to the painkillers because their brain is like saying that they need more. Even though they don't. And then it's pretty sad. So coming to our last question, while it depends across multiple variables, is it true that drug overdoses may lead to the patient requiring surgery, and why or why not?
Any patient who has addiction issues, it's always a concern, even for just the surgeries that we do. But particularly a patient is, say, dependent on narcotic medications. So you raised a good point that, the kind of thinking we should, get rid of is that these are addicted patients, say, for instance, for narcotic medication. People think it's just a matter of willpower. Why don't you just stop it? Right? It's bad for you. Just one day they can stop it. So it's not as simple as it. It's a physical as well as an emotional and psychological dependence. So people think it's that little high or mental gratification. That's why they're doing it. But in addition to that, your body, you can stop somebody's narcotics on one day. That person will die of what's called the withdrawal. So your brain has over time adapted to the amount of narcotics circulating in the blood. So there are what's called the receptors, opioid receptors on the brain cells as well as elsewhere in the body. So they are adapted to it. And then suddenly you stop giving the narcotic medication. These patients, their body chemistry changes completely and they'll die from a withdrawal. And this is the same thing with alcohol. So if someone is alcohol dependent, addicted to alcohol, you can't stop it. You have to basically wean them down gradually. So it takes weeks to months for the body to readapt to that state. So
Right.
you can't stop the problem just overnight. You have to basically rehabilitate them in a very well-established program, and you have to be enormous patience. So anyway, you can imagine, right? If someone comes in and needs an operation, a simple operation, say like appendectomy. So we do this simple operation now. This is not a big operation, 20-minute operation. It's done laparoscopically with a very small, tiny incision. A young, healthy person, of course, they're going to have some pain because they have a small incisions. But say if I give a pain medication as a post-operative pain medicine to take home, because we don't want them to suffer from pain. Mm-hmm. But typically, these patients will take the medicine. Some of them won't take it at all. Yeah. That doesn't mean they don't have any pain, but they do feel the pain, but they can get by without taking pain medicine, or Tylenol is good enough for them. They'll just deal with some pain. But there are other patients who will take some pain medicine, but they'll take that we gave, narcotic medicine, but they'll take it for a day, maybe at the most 2 days. And then beyond that, they usually will not take it. So they're pretty good about this thing. But say if you are dependent on this narcotic medication, you've been hooked on it. So you've been consuming a lot of heroin all along. You do surgery on these patients, the kind of pills that we give to them, like what's called the Vicodin or these things, they're not strong enough.
They're kind of like placebos, or?
No, their body has changed, right? So they need a whopping amount of narcotic to have any kind of additional effect.
Oh, I see.
So baseline, they're already consuming very, very large amounts of narcotic medication.
Right.
So giving the typical medication we give to normal person, narcotic naive patient, that does not touch them at all. So then we have to give them a super huge dose of this narcotic medication as an outpatient. So if like you or I took that medicine, we would be dead, right? The dose is so high. So managing these patients after any kind of routine surgery, and then, you're giving a lot of amount of narcotic medications, the patient's still crying, asking for pain medicine, then you worry. Well, is there something else wrong? We thought the surgery went fine, but is there something else going on inside the abdomen? Because the patient's requiring more and more pain medication. So that will lead to additional studies, like you may have to do another CAT scan. Sometimes you may have to take the patient back to the operating room and look inside again. So these are all the concerns that we have every time we operate on somebody who is very, say, dependent on narcotic. That's one example, right? And then the other is, say, somebody who's, say, hooked on cocaine, for instance. And this increases your blood pressure and heart rate all the time, and they've been exposed to this for a long, long time. And then you subject them to anesthesia or surgery, other stressful conditions, their heart may not be able to deal with it anymore. So their heart gives out. And so typical death from cocaine is cardiovascular collapse. So the heart will function as much as it can, and then finally it just gives up. So, doing any kind of invasive procedure, surgeries, or anything on people with addiction, it's always a concern. And each individual patient, you have to really pay close attention whether things are going actually okay. You have to factor in the underlying addiction issue. Right. They will not behave like a normal person who's not a frequent user of this kind of narcotic medication.
Yeah, definitely. So thank you, Dr. Moon. And do you have any closing remarks, or is that all for today?
So we talked about vaping, you said, right?
Right.
So it was a big scare to the medical community last year. And a lot of vaping injury, I believe probably not over 100 patients, but 60-some people died last year.
Wow.
And these were horrible deaths. Okay. Yeah. Whenever you have lung issues, can you imagine dying from, drowning?
Right.
So you can't catch breath and there's nothing improving and you're suffocating, you're dying. So this is what's happening when you injure your lungs.
Mm-hmm.
And if you smoke a lot, you may live to a certain age, but at later age, your lungs are not the same as someone who never smoked. So their
Mm-hmm.
lung function is still remaining. So they may die of other things. Their heart may fail, but the lungs are still functioning at the time. But when you're dying from lung disease, right? That the period where you are sick from your lung disease and finally you are dying, during that period, you're constantly short of breath. You feel like you're drowning all the time. So
Mm-hmm.
people get on oxygen and they have to get supplemental oxygen. You see many people with a lung disease at later years, they have to carry their own oxygen.
Right.
So, vaping, it turns out that because you can't just have a pure nicotine, you have to put in some kind of oil-based thing. And then what they know is vitamin E. They use that as one of the solvents for the nicotine. So people would vape from that.
Mm-hmm.
But these things, when they go into, if you just take a vitamin E supplements, you take it by mouth, you can take a huge amount and it will never really harm you that much.
Yeah.
But on the other hand, you bring this into what I call the air sacs, that alveolar sacs.
Mm-hmm.
Over time, these kind of things accumulate. A large concentration of vitamin E is present in the wrong area, and this damages your lungs. So anything that you bring into your lungs for these, the teenagers and young adults,
Mm-hmm.
they're healthy and they don't see immediate effect of, sickness or anything like that. So they think it's okay.
Yeah.
But it's always a cumulative damage, right?
Mm-hmm.
So the more you do it, you pay for it later. So your lungs, you have to cherish. Your lungs are a very important organ. And you only want to breathe in as clean of air as possible. Like even the dust is bad. We don't want to breathe in dusty air.
Yeah.
But you don't want to actively, put these kind of chemicals into your own lungs. So vaping, I hope the teenagers and young adults, they are maturing in a way that they self-stop these kind of things, that don't develop this kind of habit. And once you get hooked on nicotine, then it's not your kind of, so you can't just stop it. The physical addiction, it is a very, very difficult process of undoing. So no one can just stop one day and just throw it and, okay, I'm not going to do this anymore. Some people can do it in terms of smoking, but it's very, very difficult. It's a long road to undo these kind of things. So the best thing is obviously not do it at all and preserve your own body. So, people live long these days because if you get adequate medical care and you don't go to war and you don't get into an accident, actually people can live many years now, 90s, 100s, it's okay. Right. But if you damage your organs by doing the wrong things, then you may not live up to your expected lifespan. So.
Definitely. Yeah. So thank you so much, Dr. Min, for talking with me today. And thank you guys for watching. And I'll see you in the next one so that you can stop the recording now.